Joining us now is Ewa Matuszewski. She is the CEO of MedNetOne Health Solutions out of Rochester. MedNetOne is a physicians organization serving hundreds of independently owned physician practices, many of those of which are primary care physician practices themselves. And as we continue through this pandemic, there's been so much focus, especially during this recent Delta variant surge, on the impact of COVID-19 on our hospital systems, with COVID-19 also still having a great impact on our primary care providers as well. And Ewa joins us now to talk about some of those issues that our primary care physicians are seeing in their practices. Ewa, thanks for being with us today.
You're welcome. Thank you for inviting me.
Appreciate it. So one of those key problems, and this is what we saw earlier on in the pandemic too, when practices were starting to reopen to non-critical care situations, and we're starting to see more people be able to go back to their primary care physician for those checkups that they missed over the quarantine period of the pandemic. But we're still seeing one of the issues with our primary care practices is that people are still seemingly reluctant to go back in for those routine checkups that are absolutely critical to maintaining their overall health.
So that's very true. And I have to say that we've had a huge opportunity to introduce telehealth services to the community and to the consumer, to the patient. And as we struggled at the very beginning of the pandemic with learning about telehealth activities, and I'm referring to virtual, just like you and I are speaking today, we're beginning to see not necessarily a surge, but an uptick in preventive services being rendered in a telehealth mode. There are so many tools that can be used by a patient, and there are so many ways in which the physician, the primary care physician, and his care team can train and educate patients on using some of those new tools, and that way they can enhance their wellness and their well-being.
We're joined by Ewa Matuszewski. She is the CEO of MedNetOne Health Solutions with us on the Megacast. And so for those that are not comfortable going back into their doctor's offices, are they still able to get those routine checkups that they would normally get in the office at the doctor's practice through telehealth means? Or can they get some of those regular checkups that way and others still need to be in person, or is there kind of a mixed bag there?
So it is a mixed bag. We have several medical directors of groups and even payers such as Blue Cross and Priority that have introduced very innovative ways of doing those annual visits. Our biggest challenge, of course, has to do with access to adequate Wi-Fi. It also has a challenge of training the elderly that perhaps do not feel as comfortable using that type of a tool as they would using, Facebook and other types of tools that are now customarily used by all generations. But I can say this, the way in which waiting rooms have gone through a change is also important. Many of our primary care physicians ask that the patients wait in their vehicles until they are called in to be seen for their visit. So those numbers of individuals sitting in that waiting room have now dramatically undergone a change where people are sitting in their cars, they're able to read their emails, they can listen to music, they can read, and then they do come in to see the physician or the physician assistant or the nurse practitioner, and then they're spending less time waiting, more time doing something that they feel benefits them while they wait.
We're joined by Ewa Matuszewski. She is the CEO of MedNetOne Health Solutions out of Rochester. It's a physicians organization that helps independently owned physician practices, particularly our primary care providers and primary care physicians and their practices. Another issue that's coming into bat now, and this is something we actually talked about in our first segment with our articles today, as we're seeing hospitalizations for COVID-19 on the rise over the last 2 weeks, a 24% increase. There is a growing concern about a twindemic again this year between COVID-19 and influenza. This was particularly discussed in this article by Dr. Allison Weinman, an infectious disease physician and senior director of antimicrobial stewardship in one of our local health systems, who had said, unlike in the previous year, where we were still social distancing and wearing masks, being that we're mostly unmasked in many places, in many capacities in our regular life today, at this moment in time, and we're not social distancing, we're being more social, we're going back to a lot of the normal activities that we had pre-pandemic, that we are at an increased risk for a greater impact on the flu season. And so primary care physicians also at this moment in time struggling to also get to make sure that their patients are getting their flu shots as well.
So what we've been doing for the last 6-7 months, when the COVID vaccine received emergency use authorization, we began to move our clinics into the community. We began creating pop-up clinics, especially in areas where individuals might be at risk. So we were in downtown Detroit with the NOAA team. We went to St. Andrew Kim, which is a very large Asian community in Farmington Hills. And I have to do a huge shout out here for Oakland County Health Department. They have been so easy to work with. They have supported what we have been doing in the area of doing an outreach or doing outreaches to those communities that most frequently don't have anyone coming to them. So the Asian community, the LGBT community, we come to you and we provide you with vaccines. We provide you with some teaching and training, as a matter of fact, and we try to dispel the myths about vaccines. Our biggest challenge all along has been the ability of providing our primary care physicians with sufficient numbers of vaccines so they can run their own vaccination clinics, as many do during the flu season. A little bit of fear. What do we tell patients? How do we find space for that 15-minute waiting period? How do we prepare for any type of emergency? So there are many moving parts that folks are truly unfamiliar with when it comes to those vaccines. The other thing is, each vial is different. So as we draw those vaccines, and this is something that is not really common knowledge to the general consumer. So when you're looking at the Moderna vaccine, you have 10 doses in that vaccine. And at the very beginning, we wanted to make sure that every single dose got into an arm. Everybody that needed a jab or a shot got it. And we were fearful that we would be opening up a vial, giving one shot, and then basically ruining the rest. Dr. Khaldoun was on a call with a group of us and said, if you give one, that means one more person is vaccinated. And we work very diligently within the community and within the at-risk community to make sure that we reduce their fear. We do a lot of educating, and we even provide stickers saying, I've been vaccinated. Best way in which to do PR in the community. Let others know that you've been vaccinated.
We're joined by Ewa Matuszewski. She is the CEO of MedNetOne Health Solutions in Rochester, leading an organization that helps serve hundreds of independently owned primary care physician practices in our local area. And another thing that's affecting our primary care physicians, not so much them directly, but mostly their patients or potential patients, is that as we start to come slowly emerging out of the lockdown portions of the pandemic with all the restrictions in place and the other precautions that were in place, we're having less focus on the impact of the social determinants of health, or SDOHs, that are still preventing people from being able to access their primary care physicians or a primary care physician to get those regular checkups, whether that be access to transportation or to technology for telehealth means, or access to healthcare services as well, like health insurance or Medicare or Medicaid, in order to obtain those services. Those are also continuing to be an issue that primary care physicians are seeing at their practices, where they're not able to get some of those other patients back, especially if they've had a lifestyle change, as so many have over the course of the pandemic.
So that's very true, and it's so important for all of us to understand those social determinants. And it's not enough for a physician and a practice team to identify the social determinant. You've got an issue with transportation and I've identified it. Well, then what? It is so important for every physician practice and their practice team to identify resources where they can send individuals for help or arrange for that help to be provided. One of the most important areas that we've been focusing in on is the training of community health workers and also the training of care teams in physician practices. And I really have to put a huge shout out here to Blue Cross, because they have been funding ongoing training through their physician group incentive program to ensure that it's not enough just to say something is wrong, but come up with a solution. And once you've come up with that solution, share it with your colleagues, share it with others. What we at Medical Network One have done, because of gracious funding from several donors, we've actually acquired a couple mobile clinics. Those mobile clinics are not just to go ahead and identify and address medical needs. We have such a demand for mental health services in the community, and we've partnered with the Judson Center and the development centers to begin looking at how we might be able to identify areas where our buses and our behavioral health people can come in and not only address social determinants, but also serve as mini crisis centers, mini SUD, substance use disorder, medication-assisted treatment spots. And those spots are probably those spots are going to drive improvement in access to care, improvement to individuals truly engaging in care services and care activities, and then not having the fear of where do I go to get that treatment? Because it'll come to you. You won't have to go there.
We're joined by Ewa Matuszewski. She is the CEO of MedNetOne Health Solutions, located in Rochester. It's a physicians organization. It's helping many of our local primary care physicians practices that are independently owned here in Michigan. And another concern for our primary care physicians is the need for more mental health support services for patients of all different age groups, but particularly for our young patients, for our youth and teen patients who continue to have a really rough go of it because of the COVID-19 pandemic and the changes in their life, which are drastic for anybody in a crisis like this, but especially for people whose bodies and whose minds especially are still developing.
And we are at the forefront with many types of activities in the community. Again, Judson Center is a certified community behavioral health organization. We partner with Judson. We provide primary care services, but conversely, we're able to network with groups such as the Salvation Army, such as some religious and community-based entities, to ensure that those members or individuals who need immediate care can receive it. And I have to thank Senator Stabenow for being such a huge proponent of that CCBHC model, and the fact that the state of Michigan just recently announced that they will be creating a demonstration project for that particular model of care. Medical Network One and other physician organizations embed behavioral health specialists in primary care. The model is called integrated care. If I, as a physician, come in and notice that you're depressed, I want to be able to not only provide you with an assessment, but I want you to receive that immediate care that you need, and then have someone work with you to structure that next step. That can be provided virtually in a telehealth environment now, so that hand-holding and that guardian angel that people might need, a person might need for behavioral health issues, is available. And again, the need for behavioral health in primary care is crucial. Whether we're looking at suicidal ideation, whether we're looking at just someone to talk about anxiety, especially the young people, it has to be there. So payers also have to restructure the way in which they are reimbursing for these services, and employer groups need to come to the table to figure out a more effective and efficient way so there's parity between mental health and physical health.
We're joined by Ewa Matuszewski, CEO of MedNetOne Health Solutions, located in Rochester. Ewa, just another minute or so left with you before we'll say goodbye today. And in the future, we're going to be hearing, as much as we've heard about hospice care in the past, one thing we're going to be hearing a lot more, consumers, particularly healthcare consumers, a buzzword that they'll be hearing going forward is palliative care and how it's different from hospice care. Give us a little bit of an overview, just briefly, about how palliative care mirrors but also differs from hospice care.
So the big difference is I can enroll anyone into a palliative care program that is in need of chronic illness oversight. We see more and more individuals these days with 4, 5, 6 chronic conditions, and they need someone to help coordinate their care. They have to have someone that can even assist them in the area of legal issues or issues of education. Tell me more about your condition. Tell me how we can help you. Tell me how we can support you. If you have a caregiver and there's caregiver burnout, how do you help that caregiver? How do you bring the family into the picture? That should not be the case in the last 6 months of life. That should be happening at the very beginning, when we need to begin the journey of talking about advanced care planning, developing advanced directives. And I can simply say that many of us just recently put together a curriculum to begin infusing palliative care into primary care as a precursor to, let's say, hospice care. But palliative care can be 1 year, 2 years, 3 years, 5 years. Hospice care, short period of time in preparation for the end of life. So I look forward to sharing more information with your listeners and your viewers on that topic of palliative care and what we all should be focusing in on in the next few years.
Well, Ewa, we appreciate your time giving us some of this insight on what our primary care physicians and their independent practices locally and across the state are thinking about right now and some of their ongoing concerns as we continue to navigate this pandemic. And appreciate your time and your insight.
Thank you. Have a great day.